Most heart attacks happen in people who were told their labs look normal. If you went to your doctor for a physical and they did a standard lipid panel, well, that panel is missing important markers that can catch a heart attack risk early, years before it happens. So to really assess risk, there are 3 labs that you need, but a routine panel skips every one of them. And the first one is ApoB. A standard panel gives your LDL, which only tells you how much cholesterol you're carrying, but ApoB tells you how many particles are carrying it. Now, why does that even matter? Well, because it's the particles that jam into your artery wall and start a plaque, not the cholesterol riding inside them. And I like to think of it like delivery trucks. LDL tells you the total cargo, but ApoB counts how many trucks are there on the road. And it's the number of trucks pushing into your artery wall that drives the damage. Now, LDL and ApoB do travel together for the most part, but that link breaks down with insulin resistance. And the latest estimates are at least 50 to 55% of the US population is somewhere on the spectrum of insulin resistance to prediabetes to diabetes. Now, the second marker is Lp(a) or lipoprotein A. And if it's elevated, it can double or even triple your risk of a heart attack. And this one you're born with. And about 1 in 5 people carry a high level but have no idea they're high risk. Lp(a) is stickier than most cholesterol, so it's quicker to form a clot, and unfortunately diet and exercise barely move this number. You only need to check it once in your life because it's genetic, and if it's elevated, the goal is to aggressively reduce other risk factors for heart disease. And there's some very promising drugs that will treat this and will be able to lower your Lp(a) that are coming down the pipeline and will probably be available as early as 2027. And the third marker is not related to cholesterol at all, but it measures low-grade inflammation, and it's called high-sensitivity CRP. In a large study of more than 400,000 people, the individuals with a high-sensitivity CRP, so those greater than 3 milligrams per liter, had a 61% higher risk of cardiovascular death compared to people whose hsCRP was less than 1. So if you've never had these checked, ask your doctor for these labs and do not settle for just a standard lipid panel. Now, this doesn't mean that your standard lipid panel doesn't matter. Your LDL and your triglycerides are still helpful numbers to track, but it's incomplete, especially if you have insulin resistance or any conditions that go hand in hand with it. So it would be things like fatty liver or PMOS or high blood pressure.